Hi, Andrea. How are you feeling tonight?
Hi, I'm feeling great. How are you?
I am very, very happy to have you back, and I am very happy that you will actually present this particular topic. And welcome everyone to our webinar tonight. And we are definitely happy to have you here as well. I do see some familiar names right here, so I am very happy that you were able to join us tonight as well. And before we start with Andrea's presentation, as always, I want to mention that my IVF is now part of European Fertility Society, and we are very proud to be able to bring all those webinars to you. And well, there is an amazing team here that is supporting you, but also there are amazing experts like Andrea today that are bringing different topics. And this week we have the main topic is lifestyle and fertility. And Andrea today will be talking about understanding stress and fertility. And as we know, stress can be very, very difficult matter for everyone, really. So thank you, Andrea, for bringing this topic to us as well. And as always, we will start with the presentation. Afterwards, there will be time for your questions. So as always, don't forget to type those in the chat section. And after the presentation, Andrea will answer them for you. This is being recorded, so if you have any technical issues, hope not, but if you do, don't worry, you will be able to watch this tomorrow. This will be available on our website. And well, yeah, I guess that is it from me, Andrea. Again, it's always great to have you back with us. And are you ready to start?
Yes, absolutely. So I think
Wonderful.
thank
Thank
you
you so
so
much.
much for inviting me to talk about this topic. I think it's really important for us to talk about stress and fertility, but it's also a very touchy topic. And Caroline, I just wanted to ask about the slides. I think they've disappeared. Brilliant. Thank you for bringing them back. So, as I was saying, this topic is a common topic, and there's often a question of whether there is a relationship between stress and fertility. And today, I wanted to present you all the data that is available, all the guidelines, all the recommendations, all the studies, so that you can make up your mind. And then ultimately, I would like to talk to you about also some stress strategies that you can use to sort of live a more smooth journey as you are trying to conceive. For those of you who don't know me, I am a nurse consultant. I've been working in this area, helping women and couples who are trying to conceive just improve their overall lifestyle, health, and environmental factors when they're trying to conceive. My passion for working in this area comes from my own diagnosis of infertility that happened when I was very young at the age of 17. And it was something very challenging to cope with at such a young age. But it really prompted me to sort of give back to this community some of the things that I had learned as a patient, but also some of the things and the skills that I had as a nurse as well. So I tried to combine both things and give them to this community. Apart from that, I'm also a lecturer, so I teach other nurses, other healthcare professionals. I'm also an NLP coach, and I am the founder of the Enhanced Fertility Programme app. This is a brand new app that launched in November last year. And it's a free app that you can download from the App Store and the Google Store. And my idea is to make fertility education, support, and care accessible to all patients. I don't think that people should have to struggle to find trustworthy information or struggle or pay lots of money to get access to support. So I want to make it as accessible as possible. And I want you to find the right fertility treatment that you need and to feel supported along the way whilst you're having fertility treatment. So if you don't know the app yet, then you can make a note, and after the webinar, do check the App Store or the Google Store, and you'll be able to download and there's lots of things for you to explore that are free that you can use. Today, I would like to talk to you about the relationship between stress and fertility. I would like to show you the current evidence, the studies, the recommendations, tell you what works, what doesn't work, and also to talk to you about some strategies that you can use when undergoing fertility treatment to help you manage stress. So the first question I feel we need to answer is, does infertility cause stress? And this is almost like a no-brainer, because almost everyone who is struggling to get pregnant will feel distressed, anxious, stressed at one point in that journey. It's normal. It happens to a lot of people. There is a significant amount of emotional distress as a consequence of just a diagnosis of infertility. There's often feelings of shame, guilt, and low self-esteem. There's depression, there's anxiety, distress, and poor quality of life. There's an interesting study that was done a few years ago by Fertility Network UK that said that 90%, that's a huge number of people, have depression when trying to conceive, and 42% feel suicidal. It's a huge number. And here I found another study where 40% were diagnosed as having anxiety or depression when undergoing treatment. 31% were diagnosed with major depression. And there's here a large study as well where they identified that people had depression when undergoing fertility treatment. So infertility does cause stress. Okay, so there's no doubt about it. It's a very distressing situation. Here we have another study of 174 women who were undergoing treatment, and 39 also met the criteria for major depressive disorder. There's also a recent literature review. A literature review is when we combine several studies that looked at the same topic and we bring them together and say, are all these studies saying the same thing? And this literature review found that between 25 to 60% of people facing infertility had anxiety and depression, higher than people who didn't have problems getting pregnant. And then it's also important to note that a lot of the medications that are given as part of fertility treatment, like clomiphene, for example, Clomid, gonadotropins, they are associated with psychological symptoms as well, such as anxiety, depression, irritability. So you might be feeling distressed or anxious as part of your diagnosis. You might be feeling it as part of treatment, and you may also be feeling it because these drugs are making you feel that way. So I think the question of whether infertility and fertility treatment cause stress is quite easy to answer. However, the question whether stress is a cause of infertility is not so easy to answer. You might have heard comments that really hurt from a lot of people saying, just relax and it will happen. Or maybe your infertility is because you're feeling super stressed. And those comments are really, really unhelpful. And in fact, the relationship between stress and infertility is not so linear. It's not so simple. So what I would like to bring to you today to help you answer that question is I'm going to start by explaining to you what happens to our body when we are stressed. And I would like to make a distinction between the stress that we feel in a situation that happens in our life. For example, if we receive a phone call that is someone is giving some news that is very upsetting, it's normal to feel stressed about that. If we have a deadline at work, it's normal to feel stressed about that. But that is completely different to chronic stress. to living years and years and years where you're feeling constantly stressed, where you have several factors in your life, in your personal life, or in your work life, or in your social life, that are making you feel stressed. And those are two completely different situations. So, what happens to our body when we have these stressful situations happening to us? Our body's response to stress happens through what we call the Hpa axis. And this is called the hypothalamic pituitary adrenal axis. It looks like a very complicated name, but it refers to the relationship between the hypothalamus, which is located in the brain, the pituitary gland, that is also located in the brain, and the adrenal glands that are located above the kidneys. So there is a relationship between these three organs, and this is how we respond to stress. That's what's happening in our bodies. So when we are finding a stressful situation, our hypothalamus, that is situated in the brain, sends a signal to the pituitary gland that is also in the brain. And the pituitary gland will produce a hormone. And this hormone will send another signal to these adrenal glands that you can see here above the kidneys to produce cortisol. So you might have heard of cortisol in the past. It's usually called the stress hormone. So cortisol, what it does to us is it increases our levels of energy to help us cope with a stressful situation. So when we are stressed, this Hpa axis helps us respond to stress by increasing the levels of cortisol in our system. So if you're finding a lot of stressful situations in your life and you have a blood test checking your cortisol levels, for example, you might find that your cortisol levels are higher than normal. Cortisol is a glucocorticoid, and these are important not only to respond to stress, but also to regulate our immune system and to reduce inflammation. Now, these two things, reducing inflammation and regulating the immune system, are incredibly important in stressful situations when we are hurt, for example. So if you hurt yourself, for example, if you have a cut in your finger, if you're hurt, it's good to have these glucocorticoids reducing the inflammation because it will reduce your pain as well. But sometimes when you have chronic stress, that may result in an impaired communication between the immune system and the rest of the system that regulates stress. And this might be a problem. But it's different whether you are talking about chronic stress or just the occasional stress that is normal to our day-to-day life. This impaired communication has also been connected to the future development of several physical and mental health problems. People might be feeling chronic fatigue. They might develop diabetes, obesity, depression, and immune disorders. So there is that link between the chronic stress and the change to our immune system, the reducing the inflammation, and then these physical and mental health conditions. And it's important for us to be aware of this, because if we notice that we have a lot of stressful factors in our lives, we need to address those stressful factors to try and look after our emotional well-being and our physical well-being. Now, we're talking about this Hpa axis, which responds to stress, but there is another axis that I need to tell you about, which is the Hpt axis, because it's also responsible for a smaller part of the stress response. And I promise you that all of this will make sense in a while, but I need to explain to you what this Hpt axis does. So as you might imagine, it's very similar to the previous axis. It refers to the hypothalamus, again, located in the brain, the pituitary gland, again, located in the brain, and the thyroid. So it's a connection between these three. The thyroid is located here in your neck. And it's also responsible for a small portion of our stress response. And what it does is that the hypothalamus will produce TRH hormone, and this will stimulate the pituitary gland to produce TSH. If you had fertility treatment or some blood tests, you might have had your TSH levels measured already. And this TSH is going to stimulate the thyroid, the one located here, to produce thyroid hormone T3 and T4 until the blood levels are going to return to normal. And this axis, this Hpa axis, is usually genetically determined. That means it depends on your genetics, but also depends on the environmental responses and our psychosocial stress as well. So this Hpa axis, the one that we were talking about before, hypothalamus, pituitary, and adrenal glands, will start producing the cortisol, which is our response to stress. But when it produces cortisol, it will suppress the Hpt axis, the one that is related to the thyroid. So it will impair the production of TSH and prevent the conversion of TSH to T4 and T3. So there is a relationship between the axis that responds to stress and the production of thyroid hormones. And this is quite common. So again, if you're having, for example, very stressful situations in your life, you might have high cortisol levels, or you might have high levels of testosterone or low levels of TSH, then these might all be connected, and it's something that might be worth investigating. So we talked about HPA, HPT, and there is a third one, and I promise that this is the last one. It's called the HPG. And I don't know if you've heard about this one, but this is the axis that regulates reproduction. All your fertility hormones are regulated by the HPG axis. So it refers again to the hypothalamus and the pituitary glands that are located in our brain. And the G stands for our gonads. The gonads in women are the ovaries, and in men are the testicles. So the gonads is where we produce either the eggs or the sperm. So it relates to this relationship. And what happens is that the hypothalamus will produce gonadotropin releasing hormone, which is this one here. And this hormone will stimulate the pituitary gland to produce LH and FSH. And these hormones are going to stimulate the female ovaries to produce estrogen and progesterone, and the testes to produce testosterone in men. So this is really important because all of these hormones will allow the eggs and the sperm to mature until they become mature and able to be the egg to be fertilized by sperm. So without these hormones, the whole reproductive system would not work. So what we know is that there is a relationship between these three axes, okay? Apart from the fact that they all involve the hypothalamus, they all involve the pituitary gland, there is a relationship between them. So what is that relationship? So we know that the cortisol that is produced when we are facing stress is going to promote the gluconeogenesis, which is the regulation of the glucose levels as a response to stress. But it also will affect the gonadal response. So we have here on the left, we have the hypothalamus, the pituitary gland, and here are the adrenal glands, so the Hpa axis, and the production of cortisol, which is a glucocorticoid, affecting the gonads. And it affects the gonads in three ways. The way cortisol affects the gonads is first in the hypothalamus. It affects the hypothalamus because it reduces the production of gonadotropin releasing hormone. which is the one that triggers all the other hormones. Cortisol also affects the pituitary gland because it inhibits the synthesis and the release of LH and FSH. LH is the ovulation hormone. If you don't have LH, there is no ovulation. And FSH stimulates your follicles to grow where the eggs are growing inside the follicles. So these hormones are really important. And finally, what happens with cortisol is that the testes, it affects the testes and the ovaries. It changes the way the hormones are produced in the gonads. So the ovaries will have estrogen and progesterone levels affected, and the testes will have testosterone affected. So this is very important because without these hormones, like I said, again, the ovulation cannot happen, the eggs will not mature, and the sperm will not mature. So it's important to notice the relationship between the axis that responds to stress and the axis that regulates all the reproductive system. And apart from this relationship between the stress axis and the reproduction axis, there's still also a relationship with the thyroid axis, which is important to know. So we know that here the glucocorticoids, so the cortisol, is going to stimulate the gonadotropin releasing hormone, like we were saying before, which is going to reduce LH and FSH, and is going to reduce the gonadal hormone, which is estrogen, progesterone, and testosterone. But we know here that in the hypothalamic pituitary thyroid axis as well, there's here the thyroid hormone. And what happens is that this thyroid hormone can affect the production of the gonadotropin releasing hormone. So in clinical practice, when we have very low thyroid hormones, and that is called hypothyroidism, that happens that it reduces the levels of both LH and FSH, which is then going to reduce these levels as well. So in clinical practice, we would say that if you have a TSH level of 5, and this is called usually hypothyroidism, this is usually associated with implantation failure and early pregnancy loss. So it's important to know that your thyroid levels might be affecting your ability to get pregnant as well, because these axes are all connected. So I wanted to show you this today, and I know that it might seem a bit complex, but I wanted to show you that there is, in theory, all these connections that are going on, and our body doesn't work in compartments. Everything is sort of connected. So when we look at the impact that stress has on trying to conceive, it's not just this physical aspect of our hormones that is being affected, because it's also the psychological component. How do we behave when we are feeling stressed? We behave completely different to a situation when we're feeling happy. So we know that despite having a good prognosis, if the doctor says, well, I think you have very good chances of treatment working for you, and maybe you have a good financial situation, a lot of people still decide to stop treatment and not go ahead because of the stress, the emotional distress that comes, and all the psychological reasons that are associated with trying to conceive. So this is an important aspect. We also know that people who are depressed, we know that they are less likely to start treatment, but also that they are less likely to continue from cycle 1 to cycle 2 to cycle 3. And we know that couples also if you are feeling stressed, you are less likely to want to have sexual intercourse. So I think that's also an important thing to note as well. So stress changes our behaviors. It's important to know that when we are stressed, we are more inclined to eat, for example, foods that are fatty or high in sugars that are not so good for our fertility because they cause oxidative stress. So all those behaviors that are induced by stress might also have an impact on our body. So it's important to know that it's not only the physical changes that are happening when we are exposed to chronic stress, but also the behavioral changes, the social changes, the emotional changes that come with stress. How does that affect your day-to-day life? How does that affect your relationship with yourself, in your work, and with your partner, with your friends? So it's important to look at stress from an overall perspective. And whilst we're not able to eliminate stress completely from our lives, that's not realistic. It's making sure if there's anything else that we can do to avoid having chronic stress or several situations that are stressful in our day-to-day life. So you might be wondering, what works then? What works to manage stress? So we looked at different studies and we noticed that cognitive behavioral therapy is something that shows really, really good results. Acceptance and commitment therapy, education interventions, and you're all here today, and you watch all the My IVF Answers webinar. So these education strategies can help you reduce stress as well. Mind and body interventions. These are the most commonly used interventions that seem to work for couples who are trying to conceive. And research has shown that psychological interventions actually lower the psychological distress. And it's also associated with higher pregnancy rates. I'm not surprised by that these psychological interventions are associated with increased pregnancy rates. One, because if you are feeling okay and happy with yourself, you are more likely to go ahead with treatment and be okay with whatever the doctors are suggesting to you. And secondly, if you are feeling okay and you're happy and you're not distressed, you're also more likely to want to interact with your partner and have sexual intercourse. So I'm not surprised that there is such a connection between our psychological well-being and the pregnancy rates. Other things that work, you don't necessarily need to go to see a counselor or psychologist regularly. You need to find what is the right answer for you, what works for you. And it's fair to say that psychologists, counselors are a great tool, one-to-one, to learn these strategies, this CBT, acceptance commitment therapy. So I think that is definitely something that you could try. But there's also other things that you can do in your day-to-day, because we want you to feel okay, not only in that 1 hour consultation or 30 minutes consultation, we want you to feel okay 7 days of the week. Of course, responding emotionally with sadness, happiness, anger, whatever. So we feel all the emotions in the emotional wheel. However, we want you to have the skills to respond to those stressful situations without letting it spill over into the rest of your day. So there's lots of things that you can do by yourself, like relaxation interventions, yoga, meditation, mindfulness. If you like to keep a gratitude diary, there's also interesting research saying that it actually changes the brain waves. So the waves in your brain change after you practice gratitude and meditation. And the most efficient approach that we found was the professional guidance in a CBT group approach. And I want you to pay attention on this because it's so interesting to see that it's important to be in a group where you have the connection with others, saying that you know you're not alone. You know that there's other people going through it, but it's important to have the professional guidance managing the group and teaching you these CBT approaches. So there's an emphasis on education, CBT training skills, and relaxation. And it's when these three things are combined, education, CBT training, and relaxation in a group environment, that it seems to make the most difference in terms of reducing emotional distress for couples who are trying to conceive. And it's interesting to note as well that both men and women can both benefit equally from these interventions. So we're almost coming to an end, and I will answer your questions shortly, but I wanted to tell you that the app that you can download for free, you can use several of these strategies as well. So you'll have all the education available to you in 5 modules. You have mindfulness recordings that you can listen for free as many times as you want. For example, if you're going for treatment and you want to listen to a meditation before embryo transfer, just to feel that you have the strength, the connection, that you believe that it's going to work, you can listen to that. Or if you are in the 2-week wait and you want to feel the confidence that it's working, you have a meditation specifically for the 2-week wait. If you want to focus on goal setting, for example, you can focus on goal setting. So you can access all of that. We also have a lot of these self-help CBT exercises, and these are exercises that you can download on your phone, or you can send to your email, and they are a 1-page document that you can complete. For example, how to cope with challenging situations, challenging circumstances, or how to manage anxiety, how to manage sleepless nights. So we have these strategies that you can try and use for yourself. And then we have that monthly support group that is said to be the best way to resolve the emotional distress. These are groups, again, where we focus on the education, on the CBT, the relaxation techniques, and it's professionally managed as well. So you have access to all of this for free, so I would really invite you to download it. And then if you want to take the step further and you want to book a one-to-one to have that one-to-one support, or to have a professional working with you on certain aspects that you are struggling and that you're not being able to, maybe you're just having a really difficult day and you don't know how to get out of it, there is that option as well. So this is how it looks. And we are at the moment at 480 downloads, a bit all over the world, but there seems to be a lot here in the UK. And we have some research on it as well. We know that patients have felt more supported. We know that patients felt a better ability to cope with fertility treatment as well. Lots of people recommend it to others. And we want people to feel really happy with what they are getting, and we want people to continue using it. So we were quite happy to see that over 3 months, people were still using the app, listening to the meditations, watching the videos, and that resulted in lots of good reviews, which we are very, very happy about. We also won an amazing award last year. The last one was in Women's Health Tech. So we're very proud of that. We're very proud to collaborate with My IVF Answers and with the society as well now. And I would like to just a final takeaway points before I answer all your questions is that people who are facing infertility will often experience emotional distress. So if you are feeling emotionally distressed, know that you are not alone. It's a natural response to not having your expectation met. It's absolutely normal. We know that the physiological response, how your body responds to stress, and whether stress can induce infertility is not so straightforward. But what we know is that stress will predispose people to have less sex. And that is it's also a very common factor for people to stop fertility treatment. So it's important to be mindful of that. And we also learned that professional guidance in a CBT group approach is probably the most efficient way to manage stress. So I'm happy to answer any questions that you may have. And I can see here in the chat that there's lots of comments already.
That is right. Exactly. There are some comments and questions for you, Andrea. Thank you so much for the presentation. It's been brilliant as always with all the details you have provided. And you actually also explain how the stress really works. So thanks a lot for that. And yeah, there are plenty of comments. And actually, before I go ahead with the very first question, there is a comment that I'd like you to see as well, and everyone else, so you can go ahead and check the app, because I quickly checked your app just now. It's amazing. Thanks so much for providing such a support.
Mhm.
Well, couldn't agree more. If you haven't seen it yet, go ahead and do it. It's really, really useful. I've seen it myself as well.
Oh, thank you.
Thank you.
Thank you, Caroline. Thank
And
you, Bobo.
let's have a look at the very first question. Actually, there are two very similar questions, and this is a
Mhm.
very good point that Karen has put. How is it possible for the body to be experiencing significant stress internally without noticing symptoms? I was attending reflexology, and the practitioner told me that I was stressed, but I didn't notice any symptoms, so I'm a bit worried about not recognizing and addressing this.
Hmm. I think that's a very interesting question. And it might be that we're just so used to getting on with our day that we don't realize our body's response to stressful situations. But things that we probably wouldn't notice, but that could tell us that we are feeling stressed, is our muscles being tense. So that would be a common symptom. Or if we have very shallow breathing, that could also be another symptom. So I'm not sure exactly what the reflexology noticed, but there are certain signs that maybe we don't notice because we're focusing on other things and we're just getting on with life, but then we're actually feeling stressed. So it's interesting to see how does the reflexologist comment relates to how you were feeling. Were you feeling okay? Were you feeling happy, relaxed, well-being? How does it relate? Yeah, you were very calm during the appointment. And how about outside the appointment? How is your day-to-day life? Do you have a very stressful job, or do you have other stressful factors in your life? Sometimes it's family stuff. Um, I know several patients who've been through several years of being in a stressful situation, or family members who are unwell, or a job that is very demanding. And all of those things, we get really used to them. We just do what needs to be done without realizing that it's causing a long-term effect in our bodies.
Again, thank you so much. And there is a thank you, of course, from Karen as well. And let me go straight to the next question, which is actually quite similar. Okay, but let's have a look. My acupuncturist said I was very stressed, but I didn't feel stressed at all. In fact, I was very happy because the weather was good and had gotten lots done that I'd wanted to accomplish. Anything?
Yeah, that's so odd. So I don't know why the acupuncturist would say, because it's not my specialty at all, acupuncture or reflexologist. So I don't know what they base their assessment on. But again, I don't know if he was feeling something in your body that was more chronic or more long term. I don't know why the acupuncturist, he would assess to say that, Caroline. I have no idea. But I think it can be possible for us to have chronic stress over several years, even without even noticing, and then we just get used to it.
Okay, I see. Of course, thank you so much for that. Yeah, I mean, this is definitely difficult. Yeah, difficult,
Mm.
but it's as you said. I would say that it's possible that you simply not really feeling this. Let's say it's like a normal thing. I would say. All right. Thank you so much for sharing that as well. And let's have a look at the next question from Angela. What resources can I try to provide to my surrogate mother as I see that she's getting stress from her 18-month-old who's very, very active? And she told me is making our fetus baby very active at 12 weeks pregnant.
That is such a challenging situation to be in, because it's really hard for us to control what other people do. We can only control what we do, right? But ultimately, she's carrying your baby. So I don't know if you can have like a conversation with her and try and find out what does she feel she can do, what can she commit to that will help her feel more relaxed and try and protect the pregnancy. It might be that if you give them several strategies, or if you give her ideas, she can maybe choose one or two and give them a try. It may be the one-to-one support with a counselor or a psychologist or a coach, or it might be trying a gratitude diary every day, saying two or three things that they are grateful for, or just trying to introduce meditation into her day-to-day life. But I do understand, Angela, that this is a tricky one because we can only control what we do. But maybe give her some strategies and see if she can engage with any of those strategies.
Right. Thank you so much again for your advice. Yeah, maybe that's the way to do it. Thank you also for your question, Angela, as well. Okay, let's have a look. Melissa has also added, does chronic stress impact the health of the egg, sperm, or just the chances of a successful pregnancy?
So, Melissa, these two are really connected because we need a healthy egg and sperm in order to have a successful pregnancy, right? So they are really connected. I would say that stress can impact the point where there are several aspects, not only biological and physical, but also behavioral, what we are doing in response to the stress that may affect the egg and sperm health. So, when we are stressed, we're more likely to eat unhealthily, for example. We are more likely to eat foods that have a high intake of sugar or a high intake of fat, and that is related to egg and sperm health. If we have other behaviors that like that can have an impact on the health of our eggs and sperm, then that will ultimately affect our chances of a successful pregnancy. I would say that it's important here to see whether the stress factor can be addressed, and sometimes it's not. Sometimes if we have, for example, a family member who is unwell and we're caring for them, it might be really hard and there's nothing we can do about it. And what we can do in that instance is try and learn some of the strategies to learn to cope with the stressful situation itself. So either addressing the stressful factor or changing the way we respond to the stressful factor would be the ways to go ahead in this situation.
Okay, once more, thank you for that. And next question, again from Melissa. So, how long after chronic stress is being treated or is treated do you tend to see an improvement in fertility markers?
So it's never that linear, but let's say if you are making a complete lifestyle change, and you are changing your nutrition and you are changing your physical activity, you're taking your supplements, you're doing all those things that maybe you weren't doing before. When we're talking about men, it takes 74 days for new sperm to be formed. And on women, also, it takes around 3 months. So we usually say it takes 12 months to create a baby, 3 months of making these changes until we have healthier eggs and sperm, and then 9 months of pregnancy.
And thank you for that clarification as well. Okay, and next question is up. Can stress affect the regularity of your menstrual cycle?
I think day-to-day stress won't affect it, but if we have chronic stress, it can affect, because like we've seen in the beginning of the presentation, there is a relationship between the cortisol levels that reduce the amount of LH, FSH, and reduce the amount of estrogen and progesterone. So when our hormones are off balance, that our menstrual cycle might be irregular. So there may be a connection there.
Okay. Once again, thank you for that question, of course, and to your help with this. Let's have a look. Of course, more questions are coming up. Okay, let's have a look at the question from Maria. I had a failed implantation of quality embryo. You mentioned it could be thyroid. Is that common? How often does it change? If I do a thyroid test now and the next transfer in months, can it change until then?
Okay, so that is a very good question. It's important to know that implantation failure can happen for several reasons. So if you had a failed implantation, we need to check if you've had all the tests that you need to do to guarantee whether there was a problem with the eggs or sperm or the embryo. That is the most common reason for failed implantation, genetic changes. When you say there was a good quality embryo, was it a good quality embryo after having had a biopsy at a PGT test, or was it a good quality embryo just by looking under the microscope and noticing that it looked good? Because sometimes embryos look good, but when they are genetically tested, haploid, okay. So if the embryo was good, I think we need to look at the uterus itself, whether you've had changes in the uterus. And there could be, for example, if you've had a test where they look at the presence of any polyps or fibroids that could be affecting implantation. Or it could be, for example, if the uterus lining was not thick enough, or if your progesterone levels didn't last for the whole duration of the implantation period. And there's also the possibility that doctors transferred outside your window of implantation. In some women, it's a couple of days before or after. So there's a very interesting test, error test, that can tell you when your implantation window is. But okay, so progesterone level was 3 at transfer, so very low. So maybe the doctor prescribed you progesterone eggs to take, or a cream, or anything to help with implantation. If not, that might be the way forward. Yeah. So we don't know if your hormone levels, the progesterone, was low as a consequence of your thyroid. But maybe it's important to test your thyroid hormones to see if everything is okay, because if it's not, it's possible to take medicine to adjust it as well. So I think it's important to look at all the possible things that could be that could have been a cause for failed implantation. So if the embryo was normal, we need to look at the uterus, and if the uterus was okay, and then we need to look at the hormones. the hormone levels. And here we look at the reproductive hormones and we look at the thyroid hormones as well. Yeah, I think you should test your thyroid. It's very common for people to have abnormal thyroid tests. So I think it's an important thing to test. Because if it's not normal, then you can speak with your doctor and see if you can take medication before the next transfer.
All right, that sounds about right. Again, thank you so much for those follow-ups as well, of course. And Andreia, as always, thank you a lot for explaining and your advice here. All right, and let's have a look at the next question. It's regarding TSH, actually. I had a TSH of 3.34. The past two tests were 1.3 in 2019 and 0.83 in 2018. I have been put on Synthroid, not sure here, sorry, to get it below 2.5 points. I had 2 failed implantations over the course of my treatment, but I was surprised about the change in my TSH. Anything like that?
Yeah, so probably if you're already being medicated, it's because the doctors are already aware of your changes in your thyroid. So it's good that they are measuring them and making sure that you have the right levels ahead of transfer. So it's important that the doctor who prescribed the thyroid medication is speaking, or at least you are able to take that data to the doctor that does your fertility treatment and your transfers, so they can see the data and they can see your values and they can speak with each other and agree before your treatment starts. I think if you have changes in your thyroid, it could be stress, but it could be also lots of things. So you need to have an exam in your thyroid to see why is it not working properly. So it's usually a scan. Some doctors might request, if they notice any nodules, they might request a biopsy. But it's important for the thyroid doctor and it's usually an endocrinologist, to look at the reason why the thyroid is not working properly. But without doing those tests, it's impossible to say for certain what is the cause of the thyroid changes, if it's stress or if it's something else.
All right. Thank you so much for yet another thorough answer to this one. Let's have a look. Okay, I will skip to Karen once again, okay, because it's regarding TSH. So do you consider normal TSH before transfer to be below 2.5?
Okay, I'm not sure what the doctor would consider, and the values do change between UK and Europe. So I think you need to go by what your doctor would tell you. So I need to trust the fertility doctor to guide you on that. I don't want to be in between you and your doctors.
Of course. Thank you a lot for that. And there's a comment from Sarah, for our previous patient. Yes, my internist says 3.3 is not high enough to be put on meds. And thanks for the response. Right. Thanks a lot. And let's have a look at next question, okay, from Karen. So can stimulating medication used for IVF increase TSH levels? If yes, how long would it be typically take to return to better levels? During most recent treatment, TSH was 3.4. Although it was during a treatment cycle on day 10 of the stims, it had previously been 2.43. The outcome was failed implantation. So maybe it's related.
Yeah, so I'm not sure. I haven't looked into the relationship between stimulating medications and TSA levels, so I'm not sure how to respond to that. We know that stimulation medication has an impact on your psychology and your anxiety and stress levels, but I haven't looked at the thyroid hormone levels, so I would have to go back to and check that and then respond to that at a later stage, Caroline.
That's perfectly understandable. Thank you so much. Still, I can always forward this question as well. We
Mm.
can double check it. No problem here. Thank you. And Angela has added something as well. So, should I ask my clinic to do blood tests to see if any of the markers you mentioned might be out of the norm for my surrogate mother so they can address the situation? I've already asked them to offer her support.
Well, I think it depends if the surrogate mother, how is she feeling? So if she is feeling stressed, I think the most important thing, I don't think you need to test her cortisol levels. What I think you need, what I think she needs to do is consider the interventions that we've seen through research that work when people are feeling stressed so that she can reduce her stressful situation. So it might be either speaking to her or asking the clinic to offer her support, but try and look at those strategies that we've talked about before during the presentation to see if they work. I don't think you necessarily need to have her tested. Just see if any of the interventions can help her reduce the stress that she's feeling at the moment.
All right. Thank you, in such case, for yet another advice here. And there's a thank you from Karen from our previous patient to you for your help. And so let's see. Karen has also added if you have a couple of weeks in the 3 months where stress is higher and food choice is
Mm.
not so great, would that time scale you cause negative impact on eggs?
Not really. So I think a couple of weeks, that's fine. And, I usually believe that we don't need to be absolutely perfect with our nutrition or stress or lifestyle because life is just life. It's unpredictable sometimes. So it doesn't need to be perfect. We're not robots. Um, we just need to do it okay and good most of the time. So that's fine. So, and eggs grow in every cycle. So every month you have a whole batch of hundreds of eggs that are growing and maturing. So you have always new opportunities to grow and mature very good eggs.
Yep. This
Yeah.
is just
Don't beat yourself up, Karen, because that will just make you even more stressful. It's
exactly.
hard.
And we definitely don't want that.
No, it's hard as it is. If it feels like having 2 bad weeks, just have 2 bad weeks. That's fine.
Perfect. Thank you so much yet again. And let's have a look. Melissa also has added something, adding some context to my previous question about egg
Mm.
health quality. I had my eggs frozen a year ago, was under significant chronic stress in the years leading up to having them frozen. If I'm in a much better place stress wise, when it comes to using the eggs, could the stress I experience in the time leading up to egg freezing still impact the success of them?
Okay, so it is a good question. I think the most important thing when it comes to egg quality is your age. So if you have frozen your eggs when you were under 35 years old, it's likely that they will be of better quality. Okay. So I think you will not find that to be a problem. And you say if you are in a much better place stress wise when it comes to using the eggs, yeah, you were turning. So that's brilliant. So it might be that your eggs are really good. I think one thing that sometimes people don't notice is that when we do egg freezing, it's not always a guarantee of pregnancy. So we actually need a lot of eggs to achieve even an 80% pregnancy rate of having one of them leading to a baby. So it's important to have, several eggs frozen. I don't have the numbers here with me, but you need several because not all of those eggs will survive the defrosting. Not all of those eggs will be able to fertilize. Of those that fertilize, not all of them will survive to day 3. Not all of them will survive to day 5. Not all of them will survive implantation. It's like a funnel. So you have lots, and it's normal for to have very small amount of eggs at the end of the journey. So for you to have a baby, you actually have to have a lot of eggs frozen. Okay, so I think that's really good, Melissa. I think that's really clever of you to have frozen your eggs at 28. Well done.
Yes, definitely. I agree here. Thank you so much for sharing, of course, as well, Melissa. And well, best of luck. That's for sure. There are like two questions left, and we will be slowly finishing. If you have anything else you would like to add, go ahead and type the questions in. There's a thank you from Melissa as well. And Tani has also added, do you think that men problem with the thyroid can affect his sperm?
Yes, I think it can, because the thyroid, so the HPT axis, like we've seen, is connected with the HPG axis. So thyroid problems can affect the ability of the pituitary gland to stimulate the testicles to produce testosterone, and testosterone is really important for male reproduction. So I think it's important for men to test their thyroid levels as well.
Yes, thank you so much for the clarification here. And at least for now, it seems that that might be our last question for tonight. So let's have a look. Short, should cortisol levels be tested on their own as part of other tests to get a full picture of stress?
Yeah, I've heard that there's some tests in the market that test cortisol levels. So I think if we want to know, make sure what our levels are, I think it would be good to test. But it's also good to have an idea of whether we are feeling stressed as well, and to trust our bodies. But there's definitely ways of testing, and there is I don't know what is the healthy level, but I can come back to you. If Caroline can send me
Yep,
an
that's for sure.
email, we can definitely look at that.
Mhm. Okay, no problem. I will be more than happy to do so, and I'm sure Andrea will check it for
Mm.
you and we'll get back to you. Thank
Yeah,
you so
and
much.
I'll even find a place. If you're based in UK, I know there's lots of labs that do at-home testing. So all of these hormones, we can do it just with a finger prick. So I'll even check a place where we can. If you want to have it done at home, where could you have it checked as well?
That is great as well. As you can see, there's a comment from Karen for you, and
Yeah.
perfect. There's a thank you from Tani from our previous patient. And Angela, before I let you go, there's one more question. I have put that in the chat section, but if you can just say the name of your
Yeah.
patient once more.
Yeah. It's called Enhanced Fertility. Yeah.
All right. Thank you so much. And I guess that is it. Someone is typing, but I believe that is a thank you. However, remember that if
Yeah.
you would like to get some more details, or you would like to get in touch with Andrea, it's also possible. You can use the link. You will be redirected to after we finish. And thank you all for joining us tonight, for your very amazing questions on point as always. Andrea, thank you so much as well. You are amazing as always as well. So it's always good to have you back with us. And anything else you would like to add before we go?
Well, I just, if I could give one last advice, would be don't get more stressed for feeling stressed, because I think that is quite common. So, no, the app is on Android. I can send the link here as well. But
That
so
would be great. Mhm.
don't feel stressed for feeling more stressed. So I think that is probably the risk we take. So just acknowledge that it's absolutely normal to feel stressed, sad, angry as we go through whatever is happening in life. So it's just a problem when we feel that we're not being able to respond to the different situations that we have in our lives. And when we feel uh, that the situations are spilling over to other aspects of our life. So if you feel stressed and upset about the situation, but you're actually not being able to, shake it off, and the rest of your day you end up feeling sad and upset, that's not good. So just make sure you seek the help, but don't feel like you need to blame yourself for feeling stressed here and there. That's absolutely normal. And Caroline, I'm just finding here the link because it's definitely on Android as well.
Okay.
And I will put it in the chat as well.
Yes, go ahead and do it. Actually, I see that our patient has found it, but of course, if you can put it, that would be great. So anyone, if you didn't
Yeah.
see it yet, go ahead and do it. This is the link. Perfect. Thank you so much. Oh yeah. Okay. All right. So again, it's been brilliant, and I just want to let you know that actually Andreia will be back on Thursday, next Thursday. So if you haven't registered yet, go ahead and do it. This is another topic that we have. So well, you can just stay tuned,
Yes.
and we'll be here once more. And I just want to also mention that tomorrow we have a little break as our webinar has been rescheduled, but of course we will be back on Friday. So again, go ahead and register, and you also can find all of our previous webinars on myivfs's.com. And if you subscribe to our YouTube channel, that way you know that when the new video is uploaded. And I can only encourage you to follow us on Facebook or Instagram. There are plenty of webinars coming up. Thank you indeed, and thank you. It's so good to be back with all of you. And after such a topic as today, I can only wish you to have a relaxing evening. And thank you.
Absolutely.
Thank you, Andreia.